This is a very big story today because Connecticut is on the verge of passing the nation's toughest gun control laws today. The state, of course, is still healing from the awful Sandyhook elementary school tragedy that killed 20 young children and 6 adults in December. But some lawmakers are saying that this law does not fully address the issues that were at play at Sandyhook, including the extensive mental health issues that might have prevented this tragedy that happened in Newtown. So I want to welcome right now Dr. Paul Hokemeyer, who is a psychologist and family therapist. Hokemeyer or Hokemeyer?
Hokemeyer.
Hokemeyer. Doctor, thank you very much for being here today. You know, I want to start by playing a soundbite from President Obama in the awful days right after what happened in Newtown. This is what he promised to take on. Let's listen to that.
In the coming weeks, I'll use whatever power this office holds to engage my fellow citizens, from law enforcement to mental health professionals to parents and educators, in an effort aimed at preventing more tragedies like this. Because what choice do we have?
Mental health professionals, of which you are one, how do you feel in terms of how much mental health professionals have been brought into this conversation in truly preventing another one of these incidents?
I think it has not gone far enough, that we need to go a lot further. If we look at the numbers, we see that the connection between gun violence and mental health issues is profound. 63% of incarcerated males who are there for gun violence have either a substance abuse disorder or a mental health issue. So the connection is profound, and we need to do a much better job of getting in there and looking at those issues.
Let's take a look at a poll that shows, you know, what people blame essentially for what happened and what kind of proposals they favor to prevent it again. 85% say yes, they agree with universal background checks. 72% say let's require mental health checks. It's not something we're hearing the details of, though, because it's very difficult territory. How do you decide if somebody shouldn't have a gun, or if someone who has a family member at home, like Adam Lanza? Because we know, and let's pull up this screen, when you look at Cho, Lochner, Lanza, Holmes, all of these horrific cases, every one of these people had run-ins and interactions with mental health professionals, but it didn't help.
Right. And I think this case brings to the fore a very critical issue, which is the importance of family here. I'm a family therapist who believes in the Second Amendment. I believe that we have the right to bear arms. And so I think that the analysis has to start in the families, that our families have to be paying attention to what's happening in them and be looking for signs of mental illness, substance abuse disorders, and that's where the real analysis needs to start.
But some families feel like they have nowhere to turn. I read, accounts of witnesses and friends of Nancy Lanza's who said she knew he was dangerous. There's very little recourse for somebody who knows that they are living with a dangerous child. There's nothing more heartbreaking than hearing a mother who says, my child is potentially dangerous. They have nowhere to go. You can't institutionalize a child who has never committed a crime before.
That's exactly right, but you can be paying attention to what's happening and you can reach out. We're looking at a three-pronged approach. I think we need to look at the families, then I think we need to look at communities, and then we need to look at the legislature. So we need to be doing a better job working together to do this. I think the Connecticut law is very important because it shows a bipartisanship, that we have the Democrats and the Republicans have come together to create a law that's effective and I think responds to the tragedy.
On the gun part, but what is it really doing in terms of mental health?
Well, it's recognizing that those issues exist, and the law does contain a provision that brings it to the fore. And we are having these conversations about it, and we're figuring out, as smart, compassionate people, how to solve these problems.
I fear that the gun issue gets so much more attention than this other part of it that clearly is an essential component, don't you think?
Well,
I mean, these people would not have carried out these crimes if they did not have a mental health imbalance.
Absolutely.
Yeah.
I agree with you.
Dr. Hokemeyer, thank you very much. Good to have you here today. It's a big problem. We hope that continually bringing some attention to it will keep it in the forefront. Thank you, sir.
Thanks.
Good to see you.
22 minutes now before